Hello, everyone. Welcome back to the Road to Pregnancy podcast. I'm Malia, a second-year medical student and one of your co-hosts.
Hello, everyone. I'm Leslie Kennedy, a first-year medical student and guest on today's episode. I'm excited to join Malia today to talk about your pregnancy care options in Rhode Island.
Yeah, thank you so much for joining me today, Leslie. I'm really excited to have you on today's episode to break down who a pregnant patient might see during her pregnancy. Many times, women don't start consistently seeing their healthcare provider until the second trimester of pregnancy, which is what we're discussing this season in season 2 of the podcast. And so, this topic is also especially exciting because you're what's called a non traditional medical student, right? And you've actually already cared for pregnant patients as a healthcare provider yourself.
Yes, so I have actually been a family nurse practitioner for about 7 years now, and I've had the privilege of providing prenatal care in the outpatient setting where I worked in Colorado. I was also recently pregnant, and so I have some experience as a patient seeing these different care providers too.
Awesome. Yeah, I'm really excited to kind of hear your perspective on things as a provider, as a mother, and also as a medical student in Rhode Island. So, kind of learning, from you through all those different lenses. So, let's get into it. Walk me through how expecting moms can anticipate being monitored during their pregnancy and who might care for them during their delivery.
Yeah, for sure. So, one of the biggest misconceptions I think a lot of people have is the idea that the doctor or provider that they're seeing in the clinic for their routine prenatal visits is going to be that person who's with them at the hospital delivering their baby. And while that might be the case for some practices, most practices are actually now set up in a way where they have doctors and healthcare providers who are staffing their clinics and scheduled for outpatient appointments. And then they have a team of doctors or healthcare providers who are on call at the hospital. And so when you're ready to deliver your baby and you show up in labor, they're ready to receive you there. A lot of times these providers will work both in the hospital and the clinic, but that doesn't mean they're going to be scheduled on the same day that you're going to have your baby.
Yeah, that's definitely an important thing to be aware of. I think a lot of us have the idea that your OB is going to be with you throughout your whole pregnancy. And then at whatever day, time that you're delivering, like they just show up at the hospital and deliver your baby. But I think a lot of times, like the times have changed, and that's not always the case now. And so I wanted to ask also who might be seeing me in the clinic when I'm going in for a routine prenatal visit, say during my 20-week appointment?
Yeah, that's a great question. So there are a number of healthcare providers that you could see in an outpatient setting, and just to kind of list who your options might be, it could be a obstetrician or a OB-GYN, a family physician, a certified nurse midwife, or an advanced practice provider, which includes PAs and NPs like myself.
That's a lot of options. Can you tell me a little bit about the differences between those different providers? Like, what's the difference between an obstetrician and a family physician who provides pregnancy care?
Yeah, so an obstetrician or OBGYN is a physician who specializes in obstetrics. So that means they completed 4 years of medical school, followed by a 4-year residency in obstetrics and gynecology. A family physician is a physician who completed 4 years of medical school, but instead has done a 3-year residency in family practice. And an obstetrician provides full spectrum OB care, including outpatient OB care, attending vaginal deliveries, and completing C-sections if indicated, whereas a family physician has a more limited scope. They provide outpatient OB care, attend low risk vaginal deliveries, and typically do not do high risk care or complete C-sections.
Okay. And just to kind of clarify, so OB obstetrics, that's just all pregnancy related, like or preconception, pregnancy, delivery, postpartum care.
Yes.
Okay. And I've also heard of maternal-fetal medicine or an MFM doctor. What does their background look like and why might I have to see them?
Yeah, so a maternal fetal medicine physician is someone who has gone to medical school, completed a residency in obstetrics and gynecology, but then they go on to complete additional training with the fellowship. And that fellowship would be maternal fetal medicine, so they're a more specialized OB/GYN. They typically care for pregnant patients who have high risk pregnancies or conditions that put them in a higher risk category during pregnancy. For example, I would refer patients to MFM if they had certain pre pregnancy conditions like diabetes or heart disease. And I actually also saw an MFM myself because I had a twin pregnancy, which is inherently high risk.
I see. Okay. And so should somebody be worried if they have to see an MFM doctor?
I wouldn't necessarily put it like that. So, a lot of times, MFMs have additional training that allows them to have a little bit more nuanced conversations about management options, or they might be trained to do additional monitoring or procedures. As you guys discussed last season, you might see an MFM if you have an abnormal genetic screening test and need something like amniocentesis for further diagnostic testing. And as I mentioned, I had to see MFM during my pregnancy, and that was for regular growth scans because intrauterine growth restriction is common with twins. So they were checking how they were progressing like every four weeks once I got into the second and third trimester. But then I still saw my generalist OB for routine prenatal care too.
Okay, that's very helpful context because I think the term high risk pregnancy can be a little bit scary. But it's important to kind of, understand the reasons that you might be considered high risk and really that it's not always super scary. It's just for extra specialized care. And moving on to other care providers during pregnancy, can you tell me about a certified nurse midwife?
Yeah, so a certified nurse midwife or a CNM is a master's trained advanced practice nurse. So that means they typically have a bachelor's degree in nursing and have worked as a nurse, and then go on to complete their master's of science in nursing or a doctorate of nursing practice with a focused training in midwifery.
Okay, so are they similar to an OBGYN?
So they have a little bit more of a limited scope in that they can't perform C-sections or do like surgery, but they are able to provide outpatient OB care as well as attend vaginal deliveries. Additionally, they are trained with the nursing model versus the medical model, so they might have a little bit of different practice style, but they're fully equipped to care for any like low risk routine pregnancy.
Okay. And I just kind of wanted to point out here that we do have a lot of certified nurse midwives who are amazing, who work at Women and Infants Hospital, which we'll talk about a little bit later, but is one of the biggest hospitals in Rhode Island. And so it is very likely if you're here in Rhode Island and delivering a baby that you will encounter a certified nurse midwife at the hospital. Um, Okay, and so you also mentioned advanced practice providers like yourself who care for patients during pregnancy. Can you tell me a little bit more about the role that PAs and NPs play in pregnancy care?
Yeah. So PAs and NPs are both considered advanced practice providers, like you said, and we receive a master's level education typically. A key difference between PAs and NPs is that PAs are trained with the medical model and NPs are trained under the nursing model, typically having worked as a nurse first. So most PAs and NPs participate in the care of mom during pregnancy and after pregnancy, but not actually during the delivery.
Okay. And what did that look like for you as a nurse practitioner?
Yeah, so as a nurse practitioner at a community health center, I was seeing mostly low risk pregnancies, and I always had my physician colleagues, family physicians, and OBGYNs to consult as needed. Prenatal care was actually one of my favorite parts of my job. I loved being able to see patients like throughout their pregnancy and then also be able to care for them and their baby in the postpartum period. So they would have their baby and bring them in for like their, 2-day follow up and their 2-week follow up. So it was super cool to have that continuity.
Yeah, that's amazing. And you mentioned working at a community health center, and that's a great segue into what we wanted to discuss next. So, where in Rhode Island might you get pregnancy care from these various healthcare providers?
Yeah, so where you get care is an important decision. I might be biased, but community health centers are great access points for pregnancy care. Since I'm newer to the area, can you tell me about some community health centers here in Rhode Island where patients can find a provider for their pregnancy care?
Yeah, so there are a number of community health centers here in Rhode Island, including federal qualified health centers or FQHCs, where patients can seek care. And so these include many of the health centers, honestly, that we've talked about in previous episodes, including Providence Community Health Center, Blackstone Valley Community Health Center, and Thunder Mist Community Health Center. There are a lot more, and as always, we'll link, a list of those in the show notes. But maybe you can expand on what makes a community health center unique from your experience.
From my experience, FQHCs are great, not because not only do they provide medical services, but they typically consist of a multidisciplinary team in addition to medical providers. So that could include social workers, community health workers, nutritionists. A lot of times there's a nursing staff, and of course, like medical assistants who do a ton of support for the team. And all of this additional support provides additional services to help patients navigate the often complicated health system.
Yeah, that sounds like a great setup, especially because pregnancy can be overwhelming on its own, in addition to normal life stressors that people need to navigate with respect to their health.
Yeah, for sure. And a lot of times, these federally qualified health centers will offer a sliding scale payment option for patients who are uninsured. And that's one less barrier for you to worry about. And their support staff can even help you apply for medical insurance if needed. So, if I don't go to an FQHC, where else might I seek care in Rhode Island?
Yeah, so in Rhode Island, there are many private practice OBGYN groups who offer pregnancy care. You might just need to check who is in your insurance network. So if you live near Providence, you might go to the OGCC, which we've talked about before. That's also called the Obstetrics and Gynecology Care Center, which is associated with Women and Infants Hospital. The care team there includes OBGYNs, mainly run by resident physicians who are amazing, qualified training physicians, also certified nurse midwives, like we talked about earlier, and nurse practitioners. And they also have many support staff available for comprehensive care, including social worker and nutritionists.
That also sounds like a great option. You mentioned Women and Infants Hospital. Is that where I should plan to deliver my baby?
That's a great question. It's usually during the second trimester of pregnancy, which we sort of talked about last episode, when moms decide what hospital they're going to have their baby. This gives them plenty of time to potentially tour and register with that hospital. That way, they have some idea of what to expect at the time of their delivery. So, here in Rhode Island, over 80% of babies are born in Providence at Women and Infants Hospital.
Oh, wow. What else can you tell me about women and infants?
Yeah, so in addition to maternity care, they also offer neonatal care services, including a level 4 NICU. This is the highest level of care available should something come up with your baby during or after your delivery. And also, the hospital offers other educational resources like childbirth and parenting classes, as well as transitional programs to help better support moms when they bring their baby home.
But what if I don't live near Providence? Are there other hospitals in Rhode Island where I can deliver my baby?
Yeah, so there's Kent Hospital in Warwick, Rhode Island. There's Newport Hospital in Newport, Rhode Island. There's South County Hospital in Wakefield, Rhode Island. And there's Landmark Medical Care Center in Woonsocket, Rhode Island.
And what about when I'm at the hospital for my delivery? Who might I expect to be a part of my care team?
Oh, good point. Yeah. So, labor and delivery is full of care providers to ensure that you and your baby have a smooth and safe delivery. Integral to the labor and delivery care team is the nursing staff.
Yes, the registered nurses were a huge part of my care, both during labor as well as in the postpartum period. They're typically there to monitor your labor, help keep you comfortable, and answer any questions you might have. In the postpartum period, they were also really helpful with breastfeeding and caring for your baby, among many other things.
Yeah, and another important team member is a doula. So, doulas are skilled, non medical companions who support the birthing person during pregnancy, labor, birth, and postpartum. They provide continuous one on one care as well as offer informational, emotional, and physical support. Many patients feel more in control and confident in their birthing experience with the support of a doula.
Having someone specifically for the informational and emotional support seems essential. Is this something that's covered by my insurance?
It should be. So, here in Rhode Island, Medicaid covers doula care thanks to the Rhode Island Doula Bill passed in 2021. And if you have private insurance, it may depend on your coverage, but you can usually call your insurance provider to confirm.
That's incredible. I'm so glad doulas are getting the support and recognition for their contribution to pregnancy care.
I agree. And I think later on in the Road to Pregnancy podcast, we'll have an episode dedicated to doulas and hopefully be able to hear from a doula themselves about this process. Okay, and Leslie, are there any other team members that we should note?
I also want to give a shout out to the lactation consultants who offer specialized breastfeeding education. For me, they were super helpful, not only in offering technical support, but also guidance on like a feeding schedule, which when you have your baby and there's like so much to figure out, having that schedule laid out by someone else is essential. So lactation consultants are typically a licensed healthcare provider like a nurse who have additional certification in lactation support.
That's amazing. And Women and Infants also has a lactation team available if you plan on breastfeeding. And usually your doctor will or your nurse will come in and check on you in the postpartum period to make sure that lactation is going okay and if you would want that support from a lactation consultant.
Yeah, and a lot of times they'll have like lactation support groups that you can go to in the postpartum period as well. And it's nice to like bond with moms who just had babies and are kind of in similar situations as well.
That sounds amazing.
So, of course, there are many more incredible team members who will participate in your care behind the scenes, but I think we covered those who might be most prominent during your prenatal care and hospital stay.
Yeah, and having multidisciplinary teams offers so many benefits, but it can also be overwhelming at times to know who you're even talking to. Like, am I talking to a nurse? Am I talking to a midwife? Am I talking to the doctor? It can be confusing, and it's always okay to ask and clarify who you're speaking with because you deserve to know who you're getting your information from, and your whole team wants to support you. So if you're ever confused at any moment, ask for clarification. That's totally okay. And we hope that our conversation today is helpful in knowing what to anticipate during each stage of pregnancy care and whom you might be seeing.
Yeah, for sure. Like you said, it's totally okay to ask who's coming in. People are, especially in the hospital, people are coming in and out of the room, and you're like sleep deprived and just trying to like figure out what to do next, how to change a diaper, like why was my baby crying? So do not feel bad if you're clarifying with the person who's coming in the room what their role is. And I also want to note that these different healthcare providers are all working together and they're combining their different strengths to make sure that both you and your baby are getting the best care.
Yes, amazing. And I also wanted to note that if you are at the OGCC or at Women and Infants Hospital, you might also come across a medical student like Leslie or myself during your pregnancy care or your delivery. And that is because Women and Infants is a teaching hospital. And so you will see a lot of medical students, nursing students coming in and out. And it is absolutely your right to ask what the role of the medical student is. Usually, we're always adamant about telling you that like we're a student and we're here to learn and always have supervision from the physicians or our preceptors or the midwives. And so I just wanted to throw that out there because it is very likely that you'll see a medical student and just know that we're another part of your care team to gather information, make sure you're okay, and support you throughout this process.
Yeah, and I think like medical students tend to have a little bit more time than the providers to spend with patients. So if you ever feel like you need to talk to someone or, you want to kind of vent, medical students are also a great person to interact with during your hospital stay.
Yeah, that's a great point. Medicine is definitely a team sport, especially when it comes to pregnancy care.
Yeah, from my experience on both the healthcare provider and patient side of things, I could not emphasize that enough.
Great. Thank you so much for joining us today. Next time, we're going to dive into exercise in pregnancy, specifically in the second trimester, and Ashley will be back with us for that episode. And thank you again, Leslie, for joining us as a special guest on the episode today. It was really great to hear your perspective on things.
Yeah, it was so great to be able to share my experience, and I was honored to be a guest.
Awesome. See
See you
you
next
next
time.
time.